And they both said pretty much the same thing. We've got a great relationship, but we've been fighting about sex, same fight, for 20 years. So I was like, we'll see. You say that the relationship's great, it's just about sex, but we'll see. Well, they came into my office and turns out they were telling me the truth. They had a great relationship. They had done some relationship therapy at some point, and they had worked out some of the stuff that was rough between them. And they both said, we've got a great parenting relationship. We're totally on the same page. We have a wonderful relationship with each of our families. No in-law conflicts. We have wonderful work-life balance, satisfying careers, share in domestic tasks. And I was like, what? What?
I can see why you wouldn't believe them hearing that.
I was like, what? And they were like, no, the issue is this. We have a bad sex life. So what are we here to talk about today? We are here to talk about when a great relationship doesn't equal great sex. First off, I'm trained as a systems therapist. So I have been curious about how external and internal systems inform our individual experience. And how that works when it comes to sex is a big question. How does the external and the internal experience inform what we believe about sex, what our first consciousness, what our first thought is about sex, desire, and pleasure? And as a human, as one of my very early supervisors and mentors said, we are sexual beings from the cradle to the grave. It's part of our humanity. I had been hearing all through my training that, when you are working with a male-identified person, if they have low desire, there's either a medical problem that they need to address, like a hormonal issue, or there's something wrong with their wife in a heterosexual relationship. There's something wrong with that person, or they've got an issue with porn, or they're having an affair. But it was never really about this guy might just have low desire. The first person I ever heard address this in a non-pathologizing, not because of a hormonal issue, not because there's something wrong with his wife, way was you, Terry. In 2010, you did a segment for Good Morning America, and the issue was the guy had low desire. And you didn't ask him what his labs were and has he seen a doctor. And you didn't say, well, what's she doing that you're not attracted to her? You were like, what's your problem, dude? I mean, that's not what you said. It's what I would say. And that was so refreshing for me, because that gave me some permission to actually be like, no, it's true. I am seeing something in my office that doesn't match what I'm hearing about when I go to trainings. That was really powerful. That was in 2010. I started training with you in 2012 as I dug in to sex and relationships. And I continued to grow in sort of my understanding that the way that we've thought about it, the way that we've thought about desire, pleasure, sex, doesn't actually match the way that it's talked about in relationship therapy and in sex therapy even. Here was one of the things that I had been taught. Most of us are taught that good relationships and good sex are inextricably linked. And so if you have a couple and they come into your office and they say they're having a difficult sex life, what you really got to do is work on the relationship. Because once you fix the relational issues, the sex will just come along. There's another side to this. The vice versa is, in order to have good sex, you have to be having a good relationship. As I had couples coming into my office and they were in relationship distress, and I would ask them about what their sex life is like. They'd be like, yeah, no, it's fine. And I'd be like, you think so? Right? Like, I can admit that I had a little bit of a bias, that I wasn't quite sure that I believed them. Well, how can you be having good sex when your relationship's such a mess? Some of these truisms just don't hold up. The reality is that as therapists and coaches, we see all these constellations and descriptions of relationship and sex. So this one's pretty common, right? We're used to seeing it. There's relationship distress, and the couple talks about having a bad sex life. That one we're kind of used to. But I've also seen it where they're talking about relationship distress and they're describing a good sex life. This one's the real confusing one. When a couple comes in and they talk about having actually a high degree of relationship satisfaction, but a bad sex life. We don't see this so much in our office, high relationship satisfaction and a good sex life, but that's kind of what we're looking for, right? That's the goal. Here's the thing, is that this is just an example of some of the constellations and matches that we might see. Well, there's kind of an infinite number of these, because the reality is you can have, when you have 2 or more people in a sexual relationship, they might not describe it in the same way, just like they might not describe their relationship satisfaction in the same way. But I want to go back to that relationship satisfaction, bad sex life combo, because this was a couple that I worked with that really invited me in to checking out some of my assumptions about what it means to have a good and a bad sex life. So I worked with this couple. They came in to see me. This was early on in my training as an RLT practitioner, but I was already starting to take in a lot of what I was learning about being an RLT practitioner. But I didn't realize at the time just how many biases I had in place around what it means to have a good sex life or a bad sex life. I was reading the pre-session material that I had gotten from them, both of their intake forms, and they both said pretty much the same thing. We've got a great relationship, but we've been fighting about sex, same fight, for 20 years. And I will tell you, I'm not embarrassed to admit I hold myself in warm regard for the assumption that I made that there was actually some relationship distress that I needed to get at. So I was like, we'll see. You say that the relationship's great, it's just about sex, but we'll see. Well, they came into my office and turns out they were telling me the truth. They had a great relationship. They had done some relationship therapy at some point, and they had worked out some of the stuff that was rough between them. And they both said, we've got a great parenting relationship. We're totally on the same page. We have a wonderful relationship with each of our families, no in-law conflicts. We have wonderful work-life balance, satisfying careers, share in domestic tasks. And I was like, what? What?
I can see why you wouldn't believe them. Hearing that.
I was like, what? And they were like, no, the issue is this. We have a bad sex life. He was like, she doesn't desire me in the way that I want. She was like, well, I don't mind sex, but I could kind of take it or leave it. And so I was like, okay, here we go. I know what's going on here. You don't have sex enough. And they were like, no, the frequency is not the issue. I was like, it's what? And they were like, yeah, we have sex 2-3 times a week. I was like, you've been married for 20 years, you're having sex 2-3 times a week? And you're like, we've got a bad sex life? What? I was like, so not everybody's having orgasms? And they're like, no, we are. You know, once we get going, totally great. What in the world do you mean by a bad sex life? So I'm going to pause the story here for a minute. I'm going to come back to it. As I was thinking about this case that I worked with, I kind of went back in time and thought, what were some of my assumptions that I had about what it meant when somebody said they have a good or a bad sex life? Here are some of the assumptions. One is that spontaneous desire is somehow involved. If you are having a good sex life, somebody is like feeling amorous. They want sex, not because they've planned for it or scheduled it in because it's an important part of their relationship, just because they spontaneously want it. Like somehow that's involved. The penetrative sex is the goal. That one was less of a conscious thought, because as a person that doesn't identify as straight, even though I live in a straight relationship, I sort of my conscious thought is that penetrative sex isn't always the goal. But I realized as I thought about this case that was still sort of floating around in the background for me as a bias, that there is a right kind of sex and it's penetrative sex. Another assumption about good sex is that you feel close to your partner or partners before, during, or after. Another assumption is that there's same level of desire is involved for all people. Another assumption is around frequency, that it's frequent. If it's frequent, it's good. And that everybody has to have an orgasm for it to be good sex. Those are just some. So as you're listening to this, I'm going to invite you all to think about, just for a moment, what are some of the assumptions that you have when a couple says to you, either we have good sex or bad sex? What are some of the things that you automatically just jump to? because we all have this. It's not bad. It's just what our brains do, is about some of the assumptions I realized I had about what it meant when somebody said they have bad sex or a bad sex life. These are assumptions. One assumption is that you have to work really hard at it. Man, I wish it was like the movies, and that like if you like a person, you just feel ready for it all the time. You're just like, yes, I'm in. That would be lovely. And so, one of the assumptions we sometimes have about bad sex or a bad sex life is that you have to work at it. You have to schedule it. You have to do these things. There's also some assumptions that there are good and bad types of sex, better or worse types of sex. This is one of my faves. Sex should never be only about pleasure. It should be about connection. That's one that I, think comes along with my socialization as a woman, that it's not okay to just want sex because I want sex. Yeah, I have to want sex because it means closeness. Another one is that the kind of sex we're having is outside the norm of gender expectations, whatever our identified gender might be, gender identity. Also, if it's infrequent. We have this word that we talk about sexless marriages, and it turns out that you could be having sex still and be in a sexless marriage. We've tied frequency, number of times you have sex in a year, and if you haven't passed a threshold, then you're in a sexless marriage. Talk about pathologizing and labeling something as bad sex life based on numbers versus experience, or that not everyone has an orgasm. That's another assumption that I realized just was floating out there. And again, I'm just going to invite you all to think about the infinite number of just assumptions we jump to when somebody says we have a bad sex life. So I realized I really needed to dig in to what did they mean about having bad sex, that they have bad sex life, because it didn't match any of the assumptions I had. Luckily, RLT has taught me great data gathering skills. It taught me to turn that natural curiosity I had into actual questions and to ask them, well, okay, so if it's not those things, what do you mean when you say you have a bad sex life? What he described is that she didn't desire him in the way he wanted to be desired. Yes, they had sex, but no, he didn't feel wanted by her. And she described this sort of I could take it or leave it relationship to sex, and that was what made it bad for her, was that she could take it or leave it, but she had sex with him enough that she was like, why does he continually tell me that I need to desire him more? So let me say how I would have worked with this before RLT, what I think traditional sex therapy and traditional relationship therapy sets us up for, which is I would have worked with him on backing off of his expectation that of frequency. I would have said maybe stop pressuring her to have sex so often. Let's take a little break from sex and really see if you can develop some closeness and intimacy in your relationship that doesn't involve sex. And I would have worked with her on not having obligatory sex, and you don't have to do that if you don't want to do it. And I'll say this about that wouldn't have been bad. That would have been perfectly reasonable, good work. That would have been perfectly reasonable. That's a perfectly reasonable way to approach it. But here's what is different in RLT, is that we talk about in phase 1 that we do data gathering to understand the dance. What was the dance of bad sex for this couple? It wasn't about frequency. It was about what their first consciousness beliefs were. When we say first consciousness in RLT, for those of you who maybe don't know those terms, first consciousness means it's our knee-jerk response. It's our first thing that occurs to us when we think about any number of things, and specifically in this case, sex. I had the opportunity to really dig into what are their knee-jerk responses? What are their first consciousness responses about sex, and address those first consciousness beliefs instead of just changing behaviorally how they did or didn't negotiate sex. We did that eventually, but what's so different is that I taught them to do that from the wise adult part of them as it relates specifically to sex. I worked with the guy on waking up to the grandiosity of his expectation, that there is a right way to be desired. And if she wasn't doing it that way, she was doing it wrong. That's what he was saying. I mean, she was like, yeah, I want to have sex with them. It's fine. But the more that he was like, you're doing it wrong, the more she was like, well, screw it then, right?
Can I ask you a question, Anna?
Yeah.
If I were to say to this guy, what is it about the way she desires you that doesn't feel right to you? And what would her desiring you in the right way look like? Really drill down to the specific. What would he say? Do you know?
That there would be, yes, absolutely, because I did ask, that's what we got to, was that there was a way in which she would be expressing love that would make him feel like he's enough, that her desire would leave him feeling like he's enough. And so we had to work on that first consciousness that that should come primarily from her, and start with, you got to be in touch with your own relationship with desire, pleasure, and intimacy, and say that that's right for you. And the way that she goes about it is not wrong. And we worked on that, and that he could still request sex from her, like that he could still say, I want to be desired by you, and that they can work on that. But if he's in that one-up position of there's a right way to be desired and you're doing it wrong, what was the likelihood that she was going to come forward with that? Like none, right? So, and to be honest, early in their relationship, it turns out that she had tried so many times. But because this is a first consciousness belief, this isn't his wise adult. This isn't his grounded self. This isn't his second consciousness belief that's asking for it, right? That part, just that first consciousness of him, just wants what it wants. And when it's not feeling that, it blames her. And so what RLT, what I've learned from you, Terry, is to take that kind of grandiosity on. And address it directly and say, you get to want, but you don't get to demand and say it's wrong. Because, not because you don't get to, but because if you do, you're not actually going to get what you want. So you got to come into relationship with that part of you that wants what it wants, when it wants it, how it wants it, in the way I say, and limit that in that way that we teach in RLT about loving limits for that first consciousness of us. There was another factor to this, which was, it turns out that early on in their relationship, there had been a time when she had been feeling amorous towards him. They had started, they were right towards the beginning of their dating relationship. And she had had more sexual experience than he had. So she kind of tried to like make some moves, and he was like shamed her and shut her down, and was like, because he was intimidated by her experience. Because when I dug, here's what happened is in that phase 2 way, as I was working on developing mindfulness specifically around sex, and this is what I want to point out, is that it wasn't just like they had already done work on their relationship. It wasn't a general issue. It was specific to sex, desire, and pleasure. It was specific to that. And so when I dug into that with her, like, so has your relationship with desire always been ambivalent? And she says, no, it wasn't. But early on in the relationship, when I expressed to him, she said, I have this clear memory. We're in his dorm room, and I am trying to come on to him, and he's like, don't pressure me just because you've had a lot of sexual experience. Well, for women who have been socialized to ignore desire in the first place, to ignore our cues for desire in the first place, that's unique to the socialization of girls and women. We are socialized to ignore that. And we don't have the obvious external physical cues that boys have. So it becomes really easy to ignore our cues for desire, our cues for interest. If you have a partner who also tells you that you're bad and wrong for having them, yeah, you really learn to shut off to that. So her interest in sex, she learned to be just respondent. Anybody familiar with the term respondent sexual desire? Yeah, this is actually not such a helpful term always. It was meant to help depathologize the difference in desire, but it ends up still putting the responsibility for female desire on their male partner. Male partners experience spontaneous desire, females experience respondent desire. Well, so then whose responsibility is it to tune into desire. You still have to be given permission by your male partner if you're in a heterosexual relationship. But because of this socialization, even in same gender, same sex relationships, this becomes really tricky because who then gets to initiate if you're in a same female gendered relationship? It becomes really tricky. So as we continued to work through phase 1, the data gathering, waking up, connecting with changing the dance, phase 2, working on developing that cultivated second consciousness around sex, desire, pleasure, intimacy. There was another part, which was repair. And that's a thing that we see differently in RLT than other models. Again, we don't think of it as repair as just an apology. It's about coming into connection from the wise adult part of ourselves with another wise adult person. Second consciousness to second consciousness. I take accountability for the impact that I had, and I'm not going to do that anymore. So that's what we did. And that's what RLT as a model gave me the framework to learn how to do. That's what it taught me, was to turn that natural curiosity and to question the assumptions, to question some of the beliefs that I had had. Not that they were wrong entirely, just that it's not always how it works. There's a much wider variety of that out in the world. Without RLT, if I had gone with that more traditional way of treating their sex life, I think that it would have worked. Frankly, it would have worked. But would the dance have changed between them? Not really. We would have changed the way that they behaved around sex, but the actual dance of what do I do when I want to feel desired? How do I go about that? How do I work from my second consciousness to negotiate that with my partner? And when I do or don't want sex, and to even tune into it on the other side, to be able to take initiative that's right for me or not, but to have decision, to have choice. That's what second consciousness gives us, choice. To unblock the desire, we have to tune into that second consciousness, cultivate the second consciousness. And to change the dance, we can't just change the behavior. We have to change the relationship that we have within ourselves, first and foremost, to our own beliefs about sex and sexuality and desire and pleasure.
So a couple of things as I'm listening. One, so much of working, particularly with heterosexual women, but all women, is helping them move into their own right to be erotic and have sexual pleasure.
Absolutely.
And assert that. And precisely to not be responsive repositories for male desire, but to own their own, which is the work you did with this woman. One thing that glaringly comes out as I listen to this story is the same man who was feeling one down and inadequate in the face of his wife's superior sexual experience and shamed her for her sexual desire was the same man who was complaining that she didn't have enough sexual desire.
Yeah, exactly.
I want to talk about how changing the relational dynamic doesn't always shift the sexual dynamic. But I also want to say that sometimes it does. In this case, as I listen to this, maybe not outside the bedroom, but vis-a-vis sex, I would say, using the RLT grid,
yes,
this guy was a one-up, i.e. grandiose, entitled love addict. In that, in order for me to feel good, I have to feel like you desire me. If I were one down, I would beg you to desire me. That's more woman's game. If I'm one up, I would demand that you desire me.
That's right.
And this guy is so typical of so many of us in that he was perfectly happy to complain about what he wasn't getting,
right.
Having the vulnerability of encouraging her to actually give him what he wants is a whole different ballgame.
That's exactly right.
It's so much easier for us to complain about what we're not getting than it is to ask for and encourage our partners to give us more.
Yeah.
That's straight RLT. So
it is, yeah.
Case in point here.
That's right. So here's what's interesting: is part of why I'm bringing this case in is because that you're absolutely right. Their grid placements around sex were specific to their relationship around sex. It was not the same as their grid placements outside of the bedroom.
Yeah.
Outside of the bedroom, she was one up, walled off. He was one down, boundaryless. In the bedroom, she's one down, walled off. He's one up, boundaryless. So they changed positions. And that's where very often, what's happening in the bedroom is also happening outside of the bedroom. But the part that I'm kind of making a case for is that we have to assess for what's happening in the bedroom in a really specific kind of way, because maybe it matches their grid placements outside of the bedroom and maybe it doesn't. And
which also means that if you fix the dynamic outside of the bedroom, where couple therapists have been taught, well, that'll fix the sex.
Exactly.
Guess what?
Doesn't
maybe
work.
Yes, maybe no.
Yeah. And for this couple, it didn't, right? That's exactly what we were running up against. So when they were like, yeah, we've really learned a lot about how to be good partners to each other in the 20 years we've been married, it was like, yeah, they have. Even though they have those grid placements, they had worked on, and they hadn't worked with an RLT therapist, but they had worked on, doing things differently. And it was, they mostly resisted that outside of the bedroom. But in the bedroom, it was unique. And that's where I think we have to really ask these big, difficult questions like, what does it mean when a couple says, for example, that they've got a sexless marriage? Like, what's our automatic? What's our own practitioner? As I like to say, our practitioner AC is often not as egregious as our in real life AC, but we've got one. We have to check out what our first consciousness thoughts are around how we work with our couples. And so what does it mean? What do we jump to an assumption, or do we dig into it when they say we've got a sexless marriage? I've worked with people who say we've got a sexless marriage, and I'm like, well, what do you mean when we're talking about frequency? Because that's sexless. It's been a couple of weeks.
You know what? Here's my t-shirt. Stop striving for the sex you think you're supposed to be having and start enjoying the sex you're having.
That's right.
That's my t-shirt for the day.
Well, and we can only do that from our wise adult part, right? It's only our cultivated second consciousness, specifically around sex and pleasure and desire, that can stop complaining and enjoy. The other part of it is that, particularly for people who are in marginalized positions in their relational or sexual lives, LGBTQIA folks, people in poly or ethical non-monogamy, and they come in, and if we aren't explicit about inviting them to talk about sex, we are implying that the kind of sex that they're having is wrong. Now, that might not be what we think. It might not be what we believe. But if we let our own fears about asking get in the way, that's the unintended outcome, is that for folks who have been in historically marginalized positions, in who they love, have sex with, and desire, if we as the practitioners, therapists and coaches aren't asking, they're getting the message that it's bad and wrong and they shouldn't talk about it. So I think it's so important, and you've been such a pioneer, and you taught me how to ask the hard questions. What are some of the ways you bring it up?
Here's the RLT rule. When in doubt, ask. That includes asking about asking. So if you're nervous about, is this couple going to feel imposed upon?
Yeah.
If I ask about sex, are they going to feel intruded upon? Is this the right moment? Guess what you can do? I'm curious about your sex life. Do you mind if I ask about it? You're off the hook. That's called contracting, which is big in RLT. Contracts are there to protect you. So if you say to somebody, I'm thinking about your sex life and I'd like to ask about it, is that okay with you? And they say yes, then it's harder for them to turn around and act like you victimized them. They agreed to it. People will still do it, but it's harder. Can I ask you about sex? Is this an okay time to do that? And you may get different answers from two different partners, and that's grist for the mill, and you get to deal with that. We're relational in our role as therapists. We don't know. We have humility. We don't know. You put something out, and then you see what you get, and you respond to what's in front of you. We don't have to know this in advance, but we can ask. Can I ask you about sex? Can I ask you, what is it like for a heterosexual therapist to be asking you about your gay sex life? And then you just follow what they do. Sex and money are taboo generally. So we do have a sort of cultural inhibition around, I don't want to impose on them. I don't want to be. Remember, the pass rule is the first thing we say in RLT. You have the right to pass. Yeah. You can't stop your partner from speaking, but you don't have to. Is that okay? That's the first contract we offer, the pass rule and confidentiality. You have the right to pass, so I'm not imposing. And beside that, I just asked you, is it okay? And you said, it's okay. Mm-hmm. You know what? If you have those two things in place, therapist, breathe. You're fine. It's collaborative. Don't worry about it. Go for it. So that's one. It is interesting that the idea that fixing their emotional intimacy will fix their sexual intimacy, maybe yes, maybe no. Some people have shitty relationships, but a great sex life. And that's a resource. That's positive. Yeah. Some people have a shitty relationship and a great sex life. And that's actually indicative of how walled off and how intimate they are. Right. And you look at them and you go, whether you choose to say it or not in your heart, you're going, you shouldn't be having such a great, you guys hate each other. That's pretty dissociative of you two to be having a great sex. And which of the two is it? Experience will teach you, your gut will teach you, if need be, get some supervision or peer supervision. The other thing I want to say to people is have humility. Anna, you're a trained sex therapist. I'm not. I'm a generalist. Belinda's a trained sex therapist. I'm not. And if I'm dealing with you and your partner and we're talking about sex, I have, a few cards in my back pocket over the years. If I work on the relationship and the sex follows, great. If I work on the relationship and the sex doesn't follow and we just start talking about the sex and maybe I've got an intervention, schedule sex, don't wait for it to be spontaneous. And that works, great. If after my fourth or fifth card gets played, the relationship's better, we've talked sex to death, I've tried a few of the things I know, it doesn't work. Guess what? It's time to refer the couple to a trained sex therapist, which I'm not. And I say that to people up front. I'm a generalist. I'm like a GP. Let's deal with it. We'll see how far we get. If we get, great. If not, let's get you at least a consultation with a specialist. So don't be shy about you asking for help, supervision, consultation. Don't be shy about referring them to a sex therapist. But also don't be shy about seeing what you can do before you refer them to a specialist.
I'm so glad you said that. Where is that line about it being outside of my competence? And where is it that I'm getting hung up on my own biases or beliefs and I'm stuck? Right. And so I think that is that's a fine line, just like with the couple that you were talking about where they're having a lot of relationship distress, but they also are having a good sex life and being able to use that as a resource versus no, you're using it as sort of like dissociation and avoidance. How do we know? Well, we got to stick with it for a minute and be curious in ourselves and with them. Do you have other thoughts about that?
Yeah.
I just think it's so important.
And it really comes through in your case. We have 8 million sayings in RLT, and here's one of them. Generic, weak, specific, strong.
Yeah.
And most therapists hang out at the surface, intellectual, talk, and they don't go down. And you went down. RLT therapists go down.
Yeah.
So my wife doesn't desire me in the way that I would wish her to. Okay, well, let's work on that. No. What in the world are you talking about? Like, what does that mean exactly? What does not desiring her in the way you would wish her to actually look like to you? What would her desiring you in the way you would wish her to look like to you?
Yes.
How have you responded to your discomfort? What have you actually done, said, if anything? Well, mostly I complain. And how does she respond to your... So we're in and out of going deeper into the subjective experience of the individual. We go much deeper in individual work than most couples therapists. But then we also go out feeling that way, what do you do? And then when you do that, significant other, how do you feel when they do that? And then what do you do? So it goes deep into the individual and then back to the system, from the system back into the individual, and then back. It's sort of in and out and deeper and more and more specificity. So, for example, when you drill down with the woman, you don't desire him in the way that he wants you to. Well, actually, I did.
Right.
And he shut me down.
Right.
Boom. That opened up your case. But it was your capacity to go deep with them and be specific and not tell yourself that you knew what the hell they were talking about before you actually did that opened this whole thing up. So not only inquiry, but deep inquiry. Just hold steady.
What I don't want to ignore is that these are also really important issues. So as this goes along with what Terry and I were just talking about the need to really drill down, because what was relieving for me about the first time that I heard Terry talk about male low desire, not related to a medical issue or something wrong with his wife, that was really relieving, because that wasn't so much in the discussion at the time. It is much more now. It's much more normal to talk about that now. And I am so relieved. It's one of the ways that I have seen relationship work move forward around sex and sexuality in the last really about 10 years, which is it's far less taboo to talk about male low desire than it used to be. It's always been on the table to talk about female low desire. That was like normal. But male low desire, that's taken some time to come along, and it's much, much easier to talk about these days. And it's much more in our discourse as practitioners. But there are some things that we do need to assess for outright. And so trauma, when the trauma can be dealt with within this relational framework, and when it actually does need a referral, because that's important. We also want to look at medical issues that might be happening. Sexual pain, that's real, and there's the world of physical therapy for sexual pain has just gone gangbusters in the last couple of years. So we want to assess for that and then make appropriate referrals. We want to also pay attention to age. Now, in paying attention to age, it's important that we don't go that we also check out what our biases are, and to notice, are we going into a bias about how age and sexuality and desire work together? There are some things there are reasons we have biases, because there are some things that are real and are present, and we want to check out if it's true for this particular client, for this particular couple, for this particular relational, poly, ethical, non-monogamy group that's in front of us. Because it might be, it might not be. Hormone levels and co-occurring disorders. I want to invite all of you to take just a minute and notice, as I was talking about the case that I worked with, some of the biases that can be there, as Terry and I were discussing the difficulty with bringing it up when we're working with couples and individuals, with groups, across identities. Did you find yourself thinking about your clients, or did you find yourself thinking about your own relationship with desire, sex, sexuality, pleasure? If we're honest, many of us do think about that. And in RLT, as fellow travelers, that's a core concept of being an RLT practitioner, is that we think of ourselves as, just as likely as anyone else to be facing these questions, right? Like, that's what we have to pay attention to as fellow travelers. And so just invite you to notice, well, what kind of questions are coming up for you, even about you?